We're now going to be talking to Kabo Tebo Komabi, who is a pharmacist as well as a vice chair at Independent Community Pharmacy Association. This year's theme in the Pharmacy Month, it is Think Health, Think Pharmacy. One profession, many roles. We're going to be talking now about what this means to the pharmaceutical community. Good morning and thank you so much for joining us, Kabo.
Good morning, Pule, and thank you so much for having me. Good morning to you and your listeners.
So, Kabo, what is the most important message that you are hoping to convey to the public during this time, especially considering that there are so many misconceptions about pharmacists and that people who that just, or they may be perceived as people who just are there to just give us medication over the counter?
Excellent. Thanks, Pule, for that question. And indeed, the issue about Pharmacy Month this year really is about promoting this profession of pharmacy and making it well known and understood by our communities that we serve. And the theme indeed is being Think Health, Think Pharmacy, one profession, many roles. It simply means the public, when they think about health, they should top of mind think about a pharmacist and a pharmacy. And this profession indeed has got many roles. And why do we say that? We've got academic, which is those that are in a institution of higher learning. We've got industrial, which are the ones that produce our medicines and all these pharmaceuticals that we use. And we've got hospital pharmacists. Those are the ones that are taking care of our patients in hospitals and engaging with doctors there to ensure the ultimate outcomes is what we are looking for. And lastly, and not least, we've got community pharmacists, which is what I represent. And we serve our communities right in our communities where we live. And the message is that we want to encourage the public to be aware of this profession and the pharmacies that is near them, and to say hashtag Think Pharmacy, Think Health, Think Pharmacy. Anytime you think about any health matter, Puleng, get into your pharmacy, get more information. It is usually free of charge. Access, it is well known. Our pharmacists really are working long hours, closing, I think, some of them even around 8 in the evening and 9 in the evening. So if you are coming from work, you are still welcome to pop into your nearest pharmacy and ask for health information, and the pharmacist will gladly provide. That is what we do. And that is our message to our community.
Mm-hmm. So, Kabo, I want to just get into this conversation around the ARVs that were found in water supply. It kind of also just puts the spotlight on the gap between communities and understanding of where to dispose of medication. But with this being found, could it be an individual act or it was done through an organization?
Yes, a very good question that touches indeed in our communities and the concerns that they are raising with regards to the presence of some antiretrovirals traces in our water sources. And I want to break it down quickly, Puleng. Why do we find such traces in our water streams? Many people think it is because of dumping of medicines and so forth, expired medicines and stuff. Yes, it might be, but to a lesser extent. So to a lesser extent, these traces are coming from human excretion. Those metabolites that for people that are consuming antiretrovirals, you will agree with me that we've got a high burden of HIV in this country, and therefore there's a lot of people that are on this treatment and they sorely need it. But you understand that when a medicine is being consumed by a client or a patient, not everything is being metabolized totally in the body. There are, in the excretion, you will still find some whole molecules of antiretrovirals. And I believe because of the high amount of usage of antiretrovirals in our country, that is why it has been found in our water sources. And lastly, the water treatment plants that we have in our country at the moment they are not geared to sift and remove every traces of medicines, for example, because they were really designed in such a manner that they cannot remove everything, including all these traces of pharmaceutical products. And this not only antiretrovirals, it can be antidepressants and other medicines that are used widely by our communities. So these traces are not dangerous for those that are consuming. I believe that we need to lay to rest the concern that does it mean therefore we are drinking antiretrovirals unbeknown to us? No. It is such low quantities that it will not have any effect on our consumers and our public at large. I just want to allay our fears there. But it really comes from the excretion from those that are consuming these antiretrovirals.
Yo, but still, just made me think.
Yes.
So, but is bottled water then safe, or
Yes, compared to direct consumption from the tap, cannot really be compared to bottled water, because bottled water will not have that because it's not recycled water per se. But our normal tap water is recycled water that has been treated by the water treatment plants across the country, and some of that wastewater gets refined and returned back for consumption into our normal systems. But the traces are in micrograms. Really, it's very, very tiny. But I believe that the researchers are recommending the development of regulatory guidelines that will look at the acceptable levels of ARV in the water. But it is an ongoing concern. But just to allay the fears at the moment, it is not something that can create any problem in anyone that is consuming such water or using such water. But I believe that as we advance as a country, we should indeed get some treatment plants that can respond to this, such as maybe the nanotechnology or the membrane systems that is able to take out even the pharmaceutical remnants or traces from the water. But that is a topic for another day.
Okay, so it was a two-layered question that I asked. How then do we safely dispose of medication? Maybe it has expired, or it's not.
Very good question. Yeah, that indeed we need to alert our public to say, for example, if there are expired medicines in your home, pharmacies are the only place that are recommended to take back. There is what we call medicine take back programs that we sometimes roll out during other pharmacy months or during other times of the year. As a responsible citizen, as pharmacists, we take back expired medicines or medicines that are no longer being used and dispose them of safely. We do have a protocol of medicine disposal, and it is done in such a manner that that disposition will not end up in the water streams or our rivers or even our water treatment plants. We just want to discourage those that are no longer using, for example, their medicines, and you decide to flush them. It is the wrong thing to do because you are channeling them into our water streams by so doing. So instead of flushing them, collect all those medicines, visit your nearest pharmacy. They will be able to take back those medicines. But another important matter that the public must know is that you do have your nearest pharmacy that you use. I believe it would be unfair to bring all the medicines that you have gathered from all other pharmacies into one pharmacy. So patients don't know where they get their medicines. That is the right place to return them when they are no longer useful for them, expired or obsolete. Either way, send them back to the pharmacist. He will dispose them of in a right manner. And just to expand further on that, we as ICPA, which is the Independent Community Pharmacy Association, we have taken this matter to another level where we are now looking at a system that will return the expired medicines to the pharmacies without really costing the pharmacy in terms of the disposition cost. So that program, we call it From Cradle to Grave, which means the medicines that have been manufactured by a particular company, when they are now expired or no longer usable, they must be returned to a pharmacy at the cost of that particular manufacturer. I hope that makes sense. So that ultimately we can develop a framework that gives us a responsible way of disposing of our medicines, and all the manufacturers taking the responsibility or playing a role in ensuring that the cost is not borne by the pharmacy. But at the moment, we are indeed bearing that cost. But for the safety of our communities, we do encourage that take the medicines back to the pharmacy, and the pharmacist will dispose them of safely for the safety of our environment and our children.
I just want to now move on to this one, with community pharmacists that are often the most accessible healthcare professionals. In your view, then, how can the role of the community pharmacy be expanded to better support primary healthcare, particularly in underserved communities?
Excellent question, Pulen. I must say to you, the pharmacists have long been accessible, and the role of the pharmacist is not limited to what you see behind the counter, that is filling of prescriptions. That is what most of us are familiar with. But the role of the pharmacist is far broader than that. For example, we've got clinic services, and within our clinics in the pharmacies, which are compulsory according to our regulator, the South African Pharmacy Council, we are supposed to have a private room where we can do counseling, medicine counseling, or any form of counseling. So we do have clinics in our pharmacies where a patient is encouraged to take, for example, simple tests, your BP test to know your numbers, where your sugar levels, how is your HIV status, do you want to join the weight loss program, do you want to join a smoking cessation program, and so forth and so forth. Extended program of immunization, which you call it vaccination of children and babies. We do all these services in a clinic, in a pharmacy. So the role of the pharmacist is far beyond what you see on the counter. And I want to encourage the public to utilize such services, because this is just what I could think of the calf, but the services are even more than this that I'm telling you now. So, for example, if you are taking certain medicines and you are concerned that they've added another regimen for you, you want to know if there will be drug-drug interaction, whether this medicine will not interfere with the previous treatment, you are welcome to enter into a pharmacy. They will take you into the clinic and do a proper counseling, which we call it medicine counseling. And therefore, you are able to use your medicines with confidence and with knowledge. So basically, we empower our communities with education, and that is health education and medicine education. And I think the communities must take advantage of this knowledge that the pharmacist is willing to dispense.
Right, Kgabo, thank you so much for talking to us this morning on Out and About. Where can people go for correct information? Also, be able to expand this conversation further outside of the confines of radio and what we're doing right now.
Excellent. Yes, we do have our socials. We are present in the social media. On Instagram, it is ICPA @ICPA, which is Independent Community Pharmacy Association. You can visit our website www.icpa.co.za. You can also visit the website of our regulator, the South African Pharmacy Council, which is www.pharmcouncil.co.za. I believe they are also on socials. If you just check out the SAPC, which is the South African Pharmacy Council, the ICPA is the Independent Community Pharmacy Association. You are welcome to pop in your question on our website, and our knowledgeable expert in the office will be able to respond. And just follow our links as well, which we provide. For example, smoking cessation links, how to get access to smoking cessation services, and so forth. So those are given on our website. If you can just visit us, you should be able to be familiar with some of the activities that we do as pharmacists, especially during this month, which is the Pharmacy Month in South Africa. And on the 25th is the World Pharmacy Day. We will also be continuing to expand the drive into communities with regards to pharmacy and pharmacy services.
Right.
Thanks, Pulen.
All right, that was Tshepo Komapi, who is a pharmacist and a vice chair at Independent Community Pharmacy Association. That's how we wrap up our health and wellness talk this morning on Out and About. Now we are on to other things. Now we are going to be revealing what we have in store for you on our weekly finds shortly after this.
Ahoy, matey!